So Ed, you've had tremendous success, haven't you?
The medicine has been life-changing for me, and I'm very, very grateful. Uh, the surgery I had several years ago um, basically disturbed the nerve endings in my face and my chin and my jaw. It made it impossible to do basic life events like eating and speaking. Uh, so life was really a challenge. And this particular medicine has absolutely helped me to cope with that pain.
You achieved pain control, but it took some time, didn't it?
It took a year of working with you, Dr. Stein, because I felt that dispensaries, as much as they were trying to help the patients, really didn't understand that every patient is different and the pain threshold was different. So the basic over-the-counter that they were prescribing, which was kind of a one-to-one mix of CBD to THC, wasn't appropriate for me, and I couldn't really function with it. So it took a year for me to get the right ointment, which ended up having 12 CBD to 1 THC, which is what I use during the day, and it completely mitigates the nerve damage pain that I have. But it did take experimentation for, in my case, over a year.
Were we working with you that whole time?
Oh yes, back and forth. We were going back and forth, and the real problem is if I was taking the one-to-one during the day, I really couldn't function as I should. It's very appropriate for me at night to help me relax, and the pain is gone all night, but not during the day. I needed more CBD and less THC.
So Ed, just tell us a little bit about what that pain was like before and what it's like now.
So the pain before, when the nerves are severed in your face, there's literally nothing that can be done that I found in conventional medicine. And I tried it all, from pain meds to getting injections to even lasers, cold lasers, and it would just make the pain worse and worse. So it made you feel the pain more. So not being able to chew and not being able to speak, it really lessened your quality of life. So when I found this medicine, it was from the very first day I started using it, the pain was gone. It's just that I had to make sure that I wasn't creating other imbalances in my system for some of the THC or some of the higher levels that were in the medicine. So it's just a question of, as far as life was a pain for everything. Who wanted to wake up to have that kind of pain? Now I have a normal life with the ointment I'm able to put on my face. Quite a difference.
So you've been able to figure out with our guidance that CBD-rich medicine during the day works as an ointment, and then in the evening you're using something with a little more THC.
Yes. So during the day I use the 12-to-1 CBD to THC ointment applied topically, and that just basically, you just don't feel any pain. It's numb, but you don't feel any pain from all the nerves being severed. At night, when you're moving around and you're pushing your face in the pillow, what I use then is a 1-to-1 drop, a half a dropper of 1-to-1 CBD to THC under my tongue, and then I use the same with a vape. And so basically those two together create just a nice balance and a relaxation, and I don't have any pain. I sleep a full 10 hours. It's a blessing.
So what would you say to people that are interested in trying but have fear of cannabis therapy?
Well, you're looking at one. I mean, basically, someone who never had the experience. I work and I'm involved with the chemicals and equipment. So really, our drug tests are severe. So we could never, experiment or use. So I was always worried that it would create potentially an addictions situation. But I have to say that all of the painkiller, the opiates, and all the other prescription drugs were far more detrimental to my activities than this is at all. So I would say everyone is to use the medicine with the help of your doctor in judicial amounts, work slowly with it, never take too much of anything. And, the pain medicine that this brings to the table is beyond anything that I found. And my surgery was in 2009, 2010. So I suffered almost a decade with agony, and now it's gone.
Well, we're so happy to have you be part of the clinic, and all your support is much appreciated.
Thank you. It's easy to say the things I say because it's all true.
Thanks, Ed.